Hey guys, Brock from Command here, and today we're going to be talking about weight loss. To start with, we're gonna look at the factors that typically lead to obesity. Mike Israel's got some great information on this. I'm going to borrow from him. He's a little bit edgy, but he's got some great information, and he does this sort of thing for a living. The first factor that leads to obesity is the access to hyperpalatable foods that we have here in America. They're absolutely everywhere. They're super easy to get a hold of, and generally they're inexpensive. So we have the means to purchase them. These hyperpalatable foods that are high in sugar and refined carbohydrates and are generally ultra processed, they're hyperpalatable. So it's easy to eat a lot of them because they taste so good, and they're also less satiating than whole foods, nutrient dense, complex carbohydrates, proteins, and healthy fats. And so that's a big factor leading to obesity. The second factor is our genetics. So everyone's got kind of a different level of hunger drive based on their genetics and how much ghrelin, which is the hunger hormone, that one produces. So if you're higher in hunger drive and ghrelin production, you're generally going to eat more food than other people. The third factor is actually a personality trait called conscientiousness. Jordan Peterson's personality test, called the Big Five personality test, breaks down personality into 5 major traits, and conscientiousness is one of those 5 traits. And conscientiousness is basically one's work ethic and ability to be diligent and responsible and get things done. That is what we refer to as industriousness, which is one of the sub-traits of conscientiousness. And then the other sub-trait is orderliness, and that's kind of how organized you are, how orderly you are, how picky you are. It's basically your threshold for feeling disgust. So if you're overall low in conscientiousness, you're going to be kind of going against the tide in terms of all the hard, diligent work required for holistic weight loss. And then also, if you look in the mirror or at the scale, and if you're not particularly bothered by that, then you're not going to be as motivated to make a change. So when it comes to weight loss, this really boils down to a calorie deficit. Again, there are a lot of factors here, but this is where most people would do well to start. All the factors leading to obesity, or the main ones that I just pointed out, all those point towards a calorie excess. So for a calorie deficit, what we want to do, first we want to realize that about 70 to 80% of our weight loss is going to come directly from our dietary changes. So in order to find out what a target calorie intake should be for you, what you can do is an in-body scan at a supplement superstore near you. It's a free scan, and it's going to tell you your weight, but also your body fat percentage and your lean muscle mass. Not necessarily the most accurate test out there. It's not going to be as accurate as the DEXA scan, but it should give you kind of a ballpark of your metabolic rate, which is how many calories your body burns, just keeping your body warm and your organs functioning. And then when you take into account the extra energy that you burn, just walking around and doing daily activities or exercising throughout the week, you can get kind of a total calorie intake that would be required to sustain your weight, to match the energy you're expending. And so if you subtract, let's say, 200 to 300 calories from that, and you track your calories through an app like MyPlate or MacroFactor, which is what I use, then you have at least a fighting chance at seeing some weight loss based on a calorie deficit. Another consideration here is exercise. Aerobic training as well as weightlifting have their individual benefits, and it's important, ideally we do some of both. But from a weight loss standpoint, I really like starting with weightlifting, also known as resistance training. What that's going to do is increase the lipolysis, the breakdown of your fat tissue, and it's also going to help maintain or even potentially increase your muscle mass while you're on a weight loss journey, which is going to be healthier for your metabolic health, but it's also going to give you that body recomposition that you want in order to look good and to overall be healthy. And then the one more consideration here real quick is that, if we're wanting to shed fat tissue while kind of maintaining or even increasing our muscle mass, then we also want to make sure to have a high protein intake, because that's going to tell our bodies to maintain or even increase our muscle mass. So somewhere in the 0.7 grams of protein per pound of body weight is generally where you get the biggest benefits for growing muscle. Anything up to about 250 grams of protein or so if you take your body weight and multiply it by 0.7. Up to 250 grams of protein, based on that calculation, is generally safe and effective for folks to consider. And that protein is going to be more satiating. It's going to tell your muscle mass to stick around, if not grow. And it'll your body even burns more energy breaking down protein than does sugar and refined carbohydrates. So it works on multiple levels to get that body recomp that you want. From a medical standpoint, there are a few things here. I'm not going to go over everything, but if you're not sleeping well, then it's really, you're fighting against the tide there. You need to be able to sleep well for your body to lose weight well. So addressing sleep, sleep hygiene, and getting your anxiety under control, that sort of thing, so you can sleep through the night better, is important. If you have anxiety or depression, it's going to be more challenging to do the hard work required to lose weight. And also, if you have, for instance, if you have anxiety and your cortisol levels are higher, that cortisol, that stress hormone, is going to tell your body to kind of survive and maintain the calories that it has in the form of fat tissue. And so you want to generally get into a better space with anxiety and depression, so that you have the drive to do the hard work, but also so that your body is ready to lose that fat tissue. Also, we see a lot of hypothyroidism, low testosterone, low energy from things like obstructive sleep apnea that's not been diagnosed and treated, and then occasionally also anemia or low iron stores, or aka low ferritin. And so these are just some of the things that we look at from a medical standpoint if we're suspicious that there could be a medical correlation with having trouble losing weight. Lastly, with prescription medications, they're starting with a supplement. There's a supplement called High Phenolic by Orthomolecular Products that is a polyphenol blend from different flowers, and also has some decaffeinated green coffee bean extract in there, and things that basically make you feel more full. It's just kind of a nudge in the right direction if you want kind of a low-key aid in weight loss while making the other diet and exercise changes. But we're also prescribing a lot of GLP-1 receptor agonist medications. That is the semaglutide, which is the generic of Ozempic, and tirzepatide, which is the generic of Zepbound. Tirzepatide tends to be a little bit more effective than semaglutide, but it's about, anywhere from 2 to 6 times as expensive. Semaglutide we can get for about $50 to $80 a month, regardless of the dose that you're on. The tirzepatide, unfortunately, we're running into some issues as far as getting that in for our patients, but right now we're having to switch things up a little bit and continue using Empower Pharmacy for that, unfortunately. This is just a very recent change as of the beginning of March here. That's going to run you probably in that $200 to $500 range per month, and on average maybe 5 to 10% more effective, but it's really variable for each person. A lot of people do great on semaglutide. Occasionally you need to switch to tirzepatide to see the weight loss that they want to. Some real quick pros and cons of the GLP-1s. A lot of folks end up losing significant muscle mass, most likely because you get into a really significant kind of severe calorie restriction with those medications oftentimes. And so especially if you're not lifting weights, not maintaining a decent amount of food intake, you're not lifting weights, you're not having a high protein intake diet, you're going to end up losing fat, but also a decent amount of muscle, which you're kind of shooting yourself in the foot metabolically speaking. And so it's important that if you are on one of these medications, that you do try to do some resistance training and get a good protein intake, typically aiming for that 0.7 grams of protein per pound of body weight up to 250 grams. The other thing, there's kind of a theoretical risk surrounding thyroid cancer. There are some rat studies using GLP-1 meds that showed an increased risk of thyroid cancer for rats. The FDA is looking into that right now for humans. So far, we don't have any evidence saying, hey, we're seeing thyroid cancer in patients on GLP-1s, but there's potentially a theoretical risk there to keep in mind. And overall, some folks are going to increase these medications until they're really getting really robust weight loss, while others who perhaps want the best shot at minimizing side effects like some nausea, reflux, bowel movement changes, may kind of ride on a low dose while working a little bit harder on the diet and exercise thing, to use it more as an aid instead of kind of the primary means of losing weight, and that's certainly reasonable too. So overall, talk to your medical provider at command to kind of dial this in for yourself. And all of our providers do prescribe these weight loss medications, and so definitely reach out to them if you think you might benefit from these medications, and to kind of further talk about pros and cons there. Another thing we see is when folks come off of these GLP-1s, a lot of people regain a lot of the weight that they lost, and so as that hunger signal comes back, it's easy to get right back to where you were before you started the medication. So really developing a robust strategy to keep that weight off and to kind of keep that diet and exercise dialed in a bit can be helpful to avoid that weight regain that we often see. So guys, that's a basic overview of weight loss. Our little pitch for our clinic as far as specialty services is really around those GLP-1 meds. We're using Shine RX right now for them, but we're running into some issues with tirzepatide based on a court ruling recently where we're going to have to stick with semaglutide at Shine RX, and that's going to be by far the cheapest option that's, again, generally effective for weight loss. And then for tirzepatide, we're going to have to prescribe that through Empower Pharmacy, and because they're able to continue filling that, and it's going to be in the several $100 a month general cost for you. So guys, with that, hoping that just a general overview of weight loss, complex subject, but that an overview is helpful. So talk to your medical provider at command if you are wanting to get into weight loss and you don't know where to start, and to kind of make sure that these sorts of things are going to be safe for you. And we appreciate you guys watching these monthly video newsletters, and we will see you in the next one.